I would now like to introduce our next speaker, Margo Kennedy. Margo is an oncology social worker at the Princess Margaret Cancer Centre in Toronto, Ontario, working mainly with the leukemia outpatient site. She provides supports and counseling to patients and families through all stages of their cancer journey. Working within the Department of Supportive Care has provided a deep appreciation for many stresses, barriers, and challenges that patients often encounter. Margo has been a social worker for over 20 years. She is a graduate of University of Toronto with a Master of Social Work degree and of York University with a Bachelor of Arts degree. She is a committed board member of the Melanoma Network of Canada. Welcome, Margo.
So my pleasure to be here with you tonight. What I'm going to do is review some of the most common concerns that I hear from patients every day and share some ideas of what might be helpful. And I hope by the end of the presentation, you'll feel encouraged and hopeful that there's some strategies out there that might work for you. Great. So when we talk about coping with cancer, we often hear the words mental health or mental illness. And these can have certain stigmas attached. I really like the term cancer-related distress because going through cancer, of course, you're going to feel distress. So this is very normal and expected. In terms of the common themes that many people feel concerned about when they're coping with cancer, and these will be familiar to many people, they're dealing with the practical issues like sorting out income supports and drug coverage, talking to family about what's going on, talking to children. Some of the emotional challenges, including feelings of depression and fearfulness and nervousness and being really worried, spiritual and religious concerns, physical problems, fatigue, pain, appearance changes, mobility, sexual function, sleep, and fear of recurrence. And the fear of recurrence can continue for quite some time after treatment. So I don't think there's ever a good time to have cancer, but now is especially difficult. There's whole new layers to worry about. So for example, if we think about the experience of a patient who's getting discharged from the hospital after quite a major surgery, maybe having some lymph nodes removed and so on. Before COVID, the things that they would worry about is, boy, I hope the home care order, went through and the visiting nurse is going to show up, and is she going to have the supplies she needs? Is this going to hurt? All of those kind of things. And those are, big worries. But now in the times of COVID-19, I think people are thinking, where else has this nurse been today? And has she been in another household where maybe somebody has COVID-19 and maybe no symptoms? So that's certainly a big concern. I think that some people worry too, what if something goes wrong and we have to get a hold of the doctor? Can we get an appointment right away? What if we have to go to the emergency? We don't want to do that. Other things that patients also worry about too, if we look at patients from some of the diverse ethnocultural groups, they've been dealing with COVID-19 and racism. And the media has been talking about this as, facing a double trauma and so much worry about the safety of family and friends. And so now we're adding cancer into the mix. So this can be very challenging for many people. There's been a big impact of COVID-19 on healthcare. So there's some delays in diagnosis. If you think about people who might notice a change on their skin and their mole, they might be putting off, contacting their family doctor or going to their dermatologist. So diagnosis could be delayed. There's certainly been some backlogs in surgeries, and there's been some clinical trials on hold as a result of COVID-19. And there's been a lot of differences in these areas, I think, right across the country. Managing practical issues has been another concern. So if looking at transportation to medical appointments, I have one patient who's relying on a GoFundMe campaign to pay for his taxi transportation to medical appointments. Caregiver support is another issue. So especially for patients who live alone, they've always been asked to sort of look at who they might call on as a backup caregiver. And if that wasn't hard enough, now they've got to ask their backup person, oh, by the way, in case I need you, can you make sure you keep your social circle really tight, just to protect me in case I have to call on you. There's also been a lot of restrictions to visitation policies and allowing caregivers to come into the hospital for appointments. And this has been really tough, both on patients and caregivers. It's really hard, when a caregiver can't go into the hospital to an important medical appointment or to go and visit a patient who's admitted to the hospital. There's been a lot of push towards doing virtual appointments and visits whenever it's possible, and some patients are really happy about this change. It saves all the hassle of driving downtown to the cancer center and coming into the hospital and paying for parking. But there's some patients who are not so happy about this change, who would much rather have the visit in person. I think patients too are, concerned that, doctors have, so much on their shoulders right now, and they might be a little bit hesitant in sort of bringing up concerns that they're wondering about whether or not they're important or not. So they don't always mention all of their concerns at their medical appointments. And I don't think there's ever been a time that I can certainly recall where there's been such high expectations for patients to have a lot of technological equipment to be able to manage their health care and treatment. So patients are expected to have, cell phones with data plans where they can download apps and get into their patient records to look at their schedule and so on. Even patient education sessions. Some people are telling me they really miss that they're not in person anymore. So, there's a lot of advantages to virtual platforms right now, but there's also some lacking as well. And there's some concerns for patients who aren't as comfortable with using technology or reading and writing English, or who just don't have those kind of technological access, that they're facing some real barriers to their health care. So I think before COVID, we were doing a lot of things that were working well. And now some of those things have been changed and taken away. So I think many people were really relying on their in-person cancer support groups, on going to the gym every day, maybe their knitting group or their book club, their yoga classes, their AYA social meetups, participating in spiritual and faith community activities, weekly poker group, even just planning like a little mani-pedi treat at the end of the week, going out for lunch with a friend. These were things that I think we really look forward to and kept us going, especially in going through cancer treatment. And now these things are really changed. Sometimes I think we took for granted some of these things and we really counted on them, and now that they're gone, we can feel quite lonely and isolated. I think changing over to doing everything virtually certainly is a big adjustment, and it doesn't translate over to everything. There's also some families who live outside of Canada and they're not able to get a visitor visa to come to Canada to visit their loved one who's going through treatment, and that's really difficult. So with all of these stresses happening, then on top of it, we have to start to develop some new coping mechanisms because the old ones maybe just aren't feasible at the moment. So having some anxiety is a very good thing. It makes us pay attention and change behaviors and take action. So let's say if we think about a patient who's really worried about melanoma coming back, they might be a person who's really vigilant in making sure they do their skin checks every month and eating really well and exercising, doing all these great things to stay healthy. And that's a really protective response to anxiety. In healthcare, we sort of look at 3 different areas in exploring anxiety to make sure that it's not overwhelming someone. So that would be kind of the constant fear, difficulty concentrating and enjoying activities that we used to take a lot of pleasure in, and also significant fear of the unknown. So if these things are really interfering with your life, with your recovery and your treatment. And if you feel you just can't do this or you want to give up, it's really important to speak to your healthcare team right away. Coping tools. So now we're getting into the meat of things. So it's important to reassure yourself and remind yourself that you are practicing all the recommended strategies, and these strategies work. It's also important to keep in mind taking a break or limiting the news about the pandemic and sort of looking at coping as an ongoing process rather than an event, a one-time event. This is something you're committing to every day. It can also be really helpful to focus on things that you can control during times of uncertainty. So the importance of making routines and creating some predictability in your day. We often recommend looking at sort of 3 general areas around coping. So physical health, social, and emotional well-being. So going back to the basics. So these are sort of looking back on things that your mother likely taught you. And without the basics being covered, anxiety can escalate. So I think many of us can relate to maybe going through a period of time where we had a number of nights where we didn't get very much sleep and what the impact was on us. So we might have felt, so exhausted and scattered and unfocused and forgetful and maybe really emotional, just generally worn out and overwhelmed. So if these basics aren't covered, then we can get into some difficulties. When we think about coping, one of the first things that comes to mind are often activities that are very relaxing and calming and distracting. But it's also important to think about talking to other people about what it is that's creating, this anxiety and stress. It can be really helpful to find people who can listen and who you can talk to. Sometimes we need to provide a little bit of coaching to those people to tell them exactly what it is that we need. So to let them know that, we're not looking for blanket reassurance. We're not maybe even looking for problem solving. We just want to be heard. So dealing with emotions head on can actually be a great opportunity to express important feelings and provide relief. Although we can't always do it in person right now, we have to rely on some of the kind of other virtual means and emails and phone calls to stay connected. It's also really important to notice what you're doing that's not making you feel good, and then to remind yourself to stop. So for example, if you're scrolling through your Twitter feed for half an hour and that's not making you feel good, you can stop. Instead you can, look up some YouTube clips about puppies or kittens or, the top 10 funniest commercials. Now is a time that you can start to do things that maybe you've never tried before, starting a gratitude journal, a new hobby, maybe even just establishing your sort of go-to place around, a video game or doing a jigsaw puzzle where you just don't think about any worries and concerns. You can Marie Kondo some of your habits and change them to get some more positive vibes into your life. One of the things that we're hearing about a lot right now in the media is nature therapy. So spending time in nature. And that can really help to relieve stress, anxiety, and depression. It can energize your body and your mood and calm your nerves. This can happen just by sitting in nature, taking a walk, driving, finding a peaceful place with maybe a beautiful view. So that might be water or a garden, an escarpment with fall leaves. Maybe you live in a place where there's mountains. Anywhere where there's calming sights and sounds and smells. Nature therapy goes by many terms. Sometimes it's called forest bathing or Shinrin-yoku, a Japanese term. Another term that we're hearing is indigenous land-based healing, ecotherapy, green time, vitamin N for nature therapy, wilderness cure, green prescription, whatever it's called, it's been really helping a lot of people. There was a recent study done by Cornell University that looked at, that studied students, and what they found was that even 10 minutes in nature was making a really big impact on the level of stress that students were experiencing, and it was really helping. And they measured this through muscle tension and blood pressure and looking at stress hormones, and they found it was really making a difference. This is the resources. Great. So another strategy that's working really well for many people is using mindfulness. And there's a lot of research available on the effectiveness of mindfulness activities for people who are being treated with cancer. So mindfulness can provide a very neutral space to allow anxiety just to exist, just to hold it without any judgments, listen to what it's telling you, what it needs. Mindfulness strategies can come in many forms. There's a lot of different structured mindfulness podcasts and videos that people can access right now. People can practice mindfulness just at home, maybe while gazing into a fire in your fireplace or in a fire pit outside, sitting by a real or virtual aquarium. Healing drumming. I had a patient telling me about attending a mindful dance Zoom class. So I thought that sounded really cool. So I think anything that helps us to stay in the moment and really just find our kind of relaxing go-to space can be really helpful. There's also a number of free resources that are available right now online. And Mary and Jane are going to be putting up these slides, so you can go back to these and check out some of these resources, and they're wonderful. A lot of people too are accessing, different free university courses and podcasts, doing all kinds of things right now. Another strategy that many people use are an approach that's called cognitive behavioral therapy. So CBT helps people make connections between their thoughts, behaviors, and emotions. It can help us to change assumptions about uncertainty as always being bad and unavoidable and leading to a negative outcome. So learning that you can cope with uncertainty can really help with stress and anxiety. When we have unanswered what-if questions and worries, that can spiral into feeling really helpless and out of control. So changing the question, breaking it down to make it something concrete so it's not so overwhelming, such as, I'm worried I can't cope with ... That can then be really sort of helpful, and then we can move on to some problem-solving strategies. CBT, or cognitive behavioral therapy, also helps us to make an inventory of some of our strengths and resources and to prepare if the what-if worst-case scenario does happen. Coping can be so simple. It can be looking at things that give you relief. And if you can't find those things, don't give up. Keep on looking, because there's so many ideas out there. I truly believe there's something for everybody. It can be really important and helpful to set goals, to write down your ideas so you don't forget. If you're anything like me, I think of great ideas when I'm lying in bed, and in the morning I forget about everything. So write them down and practice them every day. There's a common thread between all of these coping mechanisms, and they remind us to stop, breathe. They make us focus and stay in the moment, stay in the here and now. They can provide a much needed break from racing thoughts and uncertainty and worries about the future. Being mindful during times of uncertainty can help relieve stress and give a break about thinking about everything that might happen in the future. So some steps to consider when you're trying some new coping include, picking one that appeals to you and that you'd like to learn more about. You could consider what you might need to really set yourself up for success. So let's say if you're going to try some nature therapy, you might want to think about where you're going to go, how you're going to get there, how you're going to dress in a way that you'll feel really comfortable and nice and warm and toasty. You might want to download some music, bring a hot thermos of tea, really sort of set yourself up to give yourself everything that you might need. And then take some time to practice the new skill, to try it out every day, and to try it out at least once a day for 2 weeks to know if it's going to be effective. And then you want to evaluate. You want to look at questions to know whether or not it's working. So the goal is always going to be to try to reduce the anxiety, not to completely eliminate it. And you want to look at what you're going to notice in order to know whether or not it's working, what you're going to notice changing. And then you can decide if this is something that's working for you and you want to do more of, or if you're ready to move on. So right now, I think we're adjusting to a lot of new normals, and we're adapting every day. So although we can't greet each other with a big hug, we can learn how to smize, how to smile with our eyes behind our mask. I really like this sort of next quote because it's just a nice reminder that it's okay for our emotions to change throughout the day. That just because they're changing and we might experience some ups and downs does not necessarily mean that, we're not doing well. So sometimes our progress and our coping is not happening in a straight line. It can take a little bit of time. And again, our expectations and goals are to decrease anxiety and worry, and to know that there's going to be good days and bad days. We don't have to do this alone. Support is essential. And yes, it's definitely not the same as it was before COVID. It looks different and it feels different. There are things missing, but it is still there and it's coming in different forms. And I think we are creatures with an incredible capacity to change and adapt. I want to give a shout out here to caregivers because caregivers are going through the same issues and concerns as patients. I think any caregiver right now who's doing this in the time of COVID-19 deserves an extra special award. And speaking on behalf of all caregivers, I want you to know that we see you as our heroes. We couldn't do it without you. So if you're worried about the second wave, this is just a quick recap of what to think about and what to try out. So to keep practicing all of those public health safety measures, to keep connected virtually with family and friends and make sure you're getting that support, to take care of your emotional and mental well-being, to engage in activities which are nurturing and soothing, to take care of your physical health, and to communicate concerns to your healthcare team. I don't think we can stress the importance of just what tough times these are for people, and to be kind and compassionate to yourself and others. This next slide shows some crisis lines that are available across Canada. And just a reminder that you've got this, and the Melanoma Network is here to help you as well. So I hope this presentation gave you some ideas of, if you're looking for support, one of the first places that you can start is with Melanoma Network of Canada. Mary is just a phone call or email away.